Down. Dr. Hayley Teich, a pediatrician for Trinity Health IHA Medical Group, also has a clinical interest in infectious diseases. So, Dr. Teich, thank you for being here.
Of course.
Let's talk about what you're seeing. So, you obviously are dealing with a lot of the little ones.
Yes.
And how busy has it been? Have you seen an uptick? What are you noticing?
Yeah, we've been very busy lately, and we're seeing a lot of respiratory illnesses, including flu, RSV, COVID-19, some other viruses that we don't necessarily test for in the outpatient setting, like adenovirus, rhinovirus, and then we're still seeing a lot of strep throat as well.
Yeah, so let's break those down a little bit, get a little specific. First of all, when somebody comes in, do you need to test? Do you need to know if it's RSV or the flu or COVID? Is that important?
That's such a good question. I do think that's important, in part because it helps you know as a parent what you're dealing with and what to expect in terms of length of illness and what symptoms to look out for. But also it helps us guide parents better about when to keep your kids away from other people, how to try to slow down the spread of illness. So I do think getting tested is important.
Okay, this might be a little bit complicated. If you can simplify it for us, what's the difference? Because they're all respiratory viruses.
Correct.
Right?
Yes.
So what does that mean exactly? What's happening in their bodies? Is there a difference between those three infections?
Yeah, absolutely. So as you said, they're all respiratory illnesses. They're all transmitted via droplets. So it means that from person to person, tiny droplets go when someone's coughing or sneezing, but they cause different, slightly different symptoms. They all cause fever, cough, often runny nose. But as we know from going through the pandemic, COVID can be transmitted for a longer period of time. And so it's important to know if your child does have COVID versus flu so that you can try to quarantine for the appropriate, 5 days and then mask for 5 days afterwards.
And we know that with RSV, one of the big concerns, at least last year when we were having that outbreak, was the inability to breathe for the little ones, especially the really little ones.
Yeah, so the group of people who are at highest risk for RSV include children who are under the age of 12 months, particularly under the age of 6 months, and then also any children who have chronic lung disease or children who were born prematurely. And all of those children and infants are at higher risk for more severe symptoms of RSV, whereas in older children, it could just present like a cold.
Okay, so when does a parent take the child to the doctor? When do you say, okay, we're going to treat this at home, just lots of fluids and rest?
Yeah, so I think that first off, if you're ever concerned as a parent, you should always call your pediatrician, and we can better guide you on when to bring kids into the office versus when to stay at home and kind of watch and support your kid through it. Generally, a good rule of thumb is if your kid has had a fever for over 48 hours, then we want to see your kid, make sure we're not dealing with any more significant illness.
Because sometimes these things that start out kind of mild can turn into bigger infections and bigger problems.
Yeah, exactly. Okay. You can develop, other infections on top of a baseline viral infection, like an ear infection.
Right.
And then also there are complications from all of these viruses.
Oh boy, okay. Doctor, thank you. Dr. Teich is going to stick around. We are going to talk about the temperature outside. A lot of you are dealing with kids who are home from school because it's too cold.
Yes.
Is it too cold to go out? Let me just real quick, Doc. Is it too cold to send them outside to play?
It is too cold.
Okay, there you go. That's for Alan Longstreet specifically, because he's a big bundle them up and send them outside kind of guy. So we'll talk more about that in our next hour. Oh man, it's so cold outside, it even feels cold in the studio. So the doctor's in. We're so glad. When we talk about winter time and kids and staying safe, there's a lot of issues. But today in particular, this week, we're seeing kids home from school because it is too cold to either walk to school or stand at the bus stop. It's just too dangerous. So let's talk to the pediatrician. Dr. Hayley Teich is with us from Trinity Health IHA Medical Group. Dr. Teich, thank you for hanging out this morning.
Of course.
Let's just break down the numbers real quick. Derek is a numbers guy, and so go ahead and give us that safe range and then that unsafe range. And we're just talking temperature for the kids to play outside.
Absolutely. So, you know, we always want our kids to go outside. We want to try to get them outside at least an hour a day whenever possible, but it is really cold, particularly today, as you said. So when you're 32 degrees, when it's 32 degrees and above outside, you can feel free sending your kids outside. I think that's totally safe. Between 13 degrees and 31 degrees, send them outside, but bring them in every 20 to 30 minutes, let them warm up, and then send them out again.
Okay, so 13 to 31, take some caution, but get them out
breaks,
there.
Plenty of breaks.
Exactly. Okay. Under 13 degrees, you want to keep your kids inside. It's not safe to be outside for any prolonged period of time.
In theory, yes, but for these kids, they want. Some of them want to go. My daughter is very good at. She'll go outside. 4 minutes later, she'll come back inside. Too cold, she'll play inside. But my son, he wants to stay. He wants to get out there. He wants to play with his friends. How do you have those conversations with the kids when every other day you're saying get outside and play, but now this day you're saying don't?
Yeah, I think that I think that kids can understand that. Right now, if they want to get outside for just a few minutes, you know, when they're all bundled in multiple layers of clothing that are warm and dry, and you can say, all right, look, we're going to take a walk around the house, let's get out some jitters, and let's get back inside. But I think that you can say to kids, you know, just like when it's too hot out, we want to keep you inside. When it's too cold, we also want to keep you safe. Let's think of some active things we can do inside. Let's run around the basement.
Can we rely, so how old is your son, Derek?
5.
He's 5. Can you rely on a 5-year-old to self-regulate and know when it's time to come in?
Definitely not.
Okay.
So, yeah, so
I suppose really, at any age, do we know when it's time to come in? Sometimes adults make that mistake too.
Yeah, so kids are smaller and they lose heat more quickly. And so we know that kids are going to be more at risk of having, you know, frostbite, hypothermia than adults after prolonged periods of time. And so also kids are easily distracted and will be running around, want to keep playing. And so I don't think that it's generally a good idea to just think that your child will tell you if they're too cold.
Now, what do you do if you try to take the precautions, but something bad happened and frostbite did set in? What's step 1 as a parent?
Yeah, so frostbite is the freezing of skin and sometimes tissue underneath. And so what you look for is your child reporting pain, numbness, any graying or whiting of the skin, typically of the extremities, so of the nose, of the ears, the fingers, the toes. And so when you do see that, you want to bring your kid inside. You want to get them warm as soon as possible. A warm bath is really helpful, so not too hot, but you know, warm water to help gradually increase circulation in that skin, a warm washcloth if it's on the nose, and if after 20 to 30 minutes you still are, you know, hearing this still hurts, this is still numb, then you want to call your pediatrician.
Oh, good stuff. Dr. Teich, yeah, you got your questions answered?
I got so many more. Can we have 3 more segments of 5 minutes each?
We need a whole parenting panel here just to ask you from the babies to the big ones that I'm dealing with.
Yeah, let's start at the beginning. Colic. All right.
Thank you, doctor.
My pleasure.
We'll take a quick break and be right back.